Hey everybody, I'm talking with Walt Fritz again today. I'm going to wait just a minute to see if Walt comes on. We're going to have a conversation generally around topics that we discuss regularly, which is pain science and myofascial release in the massage therapy community. Really excited to talk with Walt again. We always pull out really interesting tidbits from our conversations, even though he and I seem to come from slightly different backgrounds in regards to body work. His training is slightly different as a physical therapist than mine as a massage therapist, but we're both deeply dedicated to manual therapy. If Walt comes on here just in a second. Walt,
Howdy.
how you doing?
Good. I noticed that you, when you typed in my invite, you called this myocardial release.
Oh, I did?
It's that darn autocorrect at play again.
Oh,
Yeah, yeah.
so here's what I've noticed recently. I've been using my phone so much for social media stuff.
hmm
Like I still use my laptop, but a lot of times I'm on the go. And my up close vision, I need reading glasses, and I
hmm
keep doing this again and again. And I actually wrote on my page the other day, I'm like, listen, if I make a typo,
Yeah, yeah,
it's like autocorrect, and I'm squinting at my phone. So
yeah, yeah. So in case somebody's coming for like cardiac rehab, this isn't the conversation. All right. Not myocardial release, it's myofascial release, or at least my version of it. So welcome.
I can also, I think, go back and edit it. So.
Okay. All right. Good. So, by the way, I
So,
I do have the MedBridge cup ready to go here.
oh, nice, nice. You
Yeah,
can
just
drink.
yeah, the from our last video, that 50 minutes of frozen shot of me, I just wanted to replicate it here for just a moment. All right.
Just if you want to advertise MedBridge. Yeah.
Exactly. Yeah, yeah. Hopefully, I'll get some extra business from that. Let me get things all set here. Can you see me okay?
Yeah, I can see you
Okay,
fine.
great, great.
Yeah, I didn't want to lose that conversation we had had. I thought it was really, really good. I was disappointed in the fact that the video froze the way it did, but
Yeah,
it's a matter of, with social media, it's consistent, ongoing output, producing more content, talking to people. I've given up on the concept of perfection.
right.
Sometimes we're going to have a myocardial release.
Okay. All right, all right. Well, my heart be still. Okay.
So today, I was trying to remember what exactly you wanted to discuss today, and I'm happy to take your lead.
Yeah, well, my topic has changed about 5 times in the last 3 days, and I think what
Yeah.
I really wanted to at least lead in with is a conversation that not only am I having on one of the larger massage groups here on Facebook, but what seems to be just this continuing questioning process from therapists about pressures, about deep pressure, about how to apply it, about how to meet the patient's belief and expectation. But then those are common questions. But then the opposite of that is, how do I not hurt myself? How do I preserve my
Yeah.
hands? How do I preserve my body? Um, I, my views on this may not be popular, and they may seem out of touch because I'm a PT versus a massage therapist. But yeah, I got some things to say, and I'd love to at least start things there. Um, I
Yeah.
wrote a I
No,
wrote
that's
a
a hot
yeah,
topic.
yeah, I wrote a blog post very recently called "Negotiating Pressures" or something like that. That speaks to the process when somebody comes to see us, where instead of them dictating or telling you what to do, or instead of me as the trained therapist telling you, my patient, here's what I'm going to do with you because this is what's best for you. I think that at some point we should have some process of negotiation, of deciding, whoops, sorry about that, of deciding, you know what, here's a pressure that we can both agree on, that it meets both of our narratives, it meets both of our safety concerns, it meets everything we're looking for in this therapeutic dynamic, this therapeutic relationship. I'm stymied. I'm numb sometimes when I read the questions about therapists fearing breaking down or their hands hurting like crazy and what can I do to preserve myself. It's like, well, stop pushing so damn hard, right? Stop doing everything your patient asks because they want you to beat the snot out of them. I don't understand that. I'm too distant from that. I get it. My MFR training was different. My PT training was different. But I want to talk about negotiating pressures. I want to talk about the distinction between being a service provider who does exactly what somebody pays you for and being a healthcare professional where you use your judgment and you have a conversation with your patient about what might be helpful. Okay? I think that those are all really useful topics to discuss.
The healthcare provider component, I think as a massage therapist, it takes a certain level of skill and a certain level of practice to get to the point where you realize that half of your job is educating your clients.
Yeah.
And even educating them based on their previous experience with other therapists about how you may work slightly differently.
Right.
You know, in the end, it is a service industry. Massage therapists have a vested interest in pleasing the client and giving the client what they want. But 9 times out of 10, what I see is this little box. And that little box is massage. One of the reasons I originally took class with you was I had a conversation with, I think it was Mike Johnson in Dallas. And my complaint to Mike was the therapist spent so much time applying lubricant and then sliding across the issue instead of engaging it. And then when Mike mentioned your class, he said, oh, you know, Walt was doing a lot of stuff where we didn't use any lubricant at all. And he's like, in fact, he was using this thing called Dyson, which I had never heard of at the time, to make more prolonged contact on a single spot.
With a broad surface area,
Yeah, I was like, that sounds really interesting. And that is a very different mindset than a lot of therapists I see online. And when I say online, we're talking, 7,000 member, Facebook groups. I think that the therapists are still delivering the routine they learned in school to fulfill the commodity requirements of what a massage is.
Right.
Instead of looking at themselves as somebody that can help people in chronic pain, helping educate clients about what that is.
My entire experience in manual therapy, well, not in school. School was different, but from my 1992 when I started this work on, has been primarily static dry engagement. So it works really well for me. So it's easy for me to get, self-righteous and self-superior to say, well, that's much better than lubricated, movement-based massage, which is probably totally false. Okay. I do think that the same principles that I speak to in my seminars and on my blog, et cetera, about more of a slower, nuanced engagement can occur with still dry work or movement, wet work, Dyson, non-Dyson, whatever that. I want to talk in the broader sense, rather than forcing you to work based on how I work. But let's work based on a process of negotiation. And I do think that could be more helpful than me trying to tell you, well, lubricant movement-based work is a less than relationship with the patient and their pain than dry, static, MFR-based type works or similar. All right. And, from that point, I do think it's the conversation we have. You talked about the commodity that a therapist delivers. PTs are no different, right? We're selling a service, but the analogy here or the mindset that if okay, let's pretend for a moment you've got a website, right? You've got a website that advertises that you do deep tissue. That's your selling point. That's your bullet point at the top of the website or something that somebody finds, right? So they're going to see that. And they say, oh, that's what I want. I want deep tissue. So they book that session with you and they come into you. And the expectation is that you deliver what you sold that person, which is fine, right? If you're all into the deep tissue work, no matter what you call it, and that's what they're looking for, the relationship will probably work really well. But if you're complaining or concerned about the deep tissue, why do you keep advertising that, right? How about shifting that dynamic a little bit where whether it's on your website or your brochure or whatever it is, right? Walt Fritz, Robert Gardner, I'm really good at helping people in pain that hasn't resolved with other methods, right? And I
Yeah.
use different skills, I use different ideas than you might be used to. And you know what? I may not work your whole body. We may work that shoulder that you're talking about, and I may work it in a very different way than you're used to. If you're that deep tissue person, that consumer, you may just, flip on to the next website. But the person, someone's going to connect with what you say. Sell them what you'd like to sell them instead of what you think they want to be sold, right?
But that process for most therapists, in my experience, because of core curriculum and massage school,
Yeah.
they have to break out of that massage box.
Yep.
Because
Yep.
what I hear is you're saying, okay,
Oh, wait a minute. Let me
deep
stop you for a
tissue.
second.
No, go
Break out
ahead.
of the massage box. That gets confusing and frustrating for people because you still could be doing massage, right? Traditional massage. It just might not be whole body, front, back, lubricant based. Please the patient, right? Negotiate what you're looking for. Negotiate the pressures. Negotiate dry versus wet, right? Sorry to interrupt, Robert.
No. The thing is, okay. So we're always going to have issues related to language, and what it seems to become is the students learn a sequence in school, and the foundation of massage, in my experience as a therapist in the industry, as an educator, is effleurage.
Okay.
Everything is stacked on top of that. When they take a continuing education class with you or I, it stacks on top of whatever they've already learned.
Right.
And I felt like a little bit like I was destroying the original box and saying, no. I'm just giving you more tools, and then you educate the client and use the tools that you think are most adequate for what you're dealing with based on your clinical experience.
Right.
Now, I'm not even against effleurage. It's just what I was doing in session was a little bit closer to you, where I was holding a static spot instead of effleurage and sliding across surface or sliding across tissue.
Right.
What I mean about destroying the massage box is I feel like the therapists feel like if they don't deliver the sequence they were taught in school, they're not giving the client what they want.
Right.
Whereas when I hear you speak, I hear not techniques. That's not what I hear at all. When I hear you talk, it's I'm going to try to help you with your shoulder.
Right. And I'm going to have a
hit your pain
conversation with
points.
you. Yeah. Sorry.
I'm going to hit your pain points. I'm going to use whatever tools available to me, and I'm going to help you with your problem. You're having neck pain? Okay, let's see if we can work on that. You're having ankle pain? Okay, let's see if we can work on that. But it's not dictating the service that you deliver. You're negotiating the service you deliver.
Exactly. And the
Most
dictation,
therapists.
they allow.
No, go ahead.
Most therapists either allow it to be dictated by the client who's paying them,
Yeah.
right? Or their employer who says do what the client wants, or they're dictating to the client. It's like, here's what's best for you. All right.
Yeah.
I think it should be that negotiation, that discussion, the conversation, what we have both verbally, non-verbally, that we have through touch, we have through the person's body and their nervous system, that should determine what's done and how it's done. All right. I get it when a beginning therapist starts, I was the same way. You're working off of protocols, you're working off of what you were taught in school, because it's a great place to sort of bide your time while you learn more, whether it's through experience or continuing ed or reading or whatever that is, right? But over time, you can do good work and make a good career by continuing to do exactly what you taught in school. And I'm not against that one bit. But if your concerns are your longevity, how do I do deep tissue without breaking down? Well, do you have to do deep tissue to help somebody? Do you have to please everybody who calls you? I have no problem with saying no to somebody on the phone, right? I have bills to pay like the rest of you, but I'm not gonna sacrifice myself nor my sense of safety for you just to please you and give you what you think you want or what you do want, right? I have business cards of people who will beat the heck out of you, right, here in the Rochester area. And I'll hand those out to people. If you really want me to beat you up, I'm not going to do it, but I'll hand you a card of a guy across town. Yeah, he's going to bruise you, right? But if that's what you want, a new question I've taken to asking, and I think it's a very valuable question, is from a basic belief system. When my patient comes in to see me or calls me or emails me, right, does this work have to hurt to help? Answer the question, right? Does it have to be painful in order to be effective. And I'm not going to sway you one way or the other. I'm just going to wait and listen for the answer, right? If you have a belief system that says, yeah, it's got to get in there deep and there might be pain, but it could be a good hurt and all those things that we explain it with, right? You're feeding me information how then to have a better conversation negotiation with you. Does it need to hurt to help? Okay. I personally don't think so at all, but I'm not you. I can't tell you what to feel. We may talk about, I may try to quote unquote educate you, but you may leave my office feeling unsatisfied because, you know what, Walt didn't hurt me or didn't go deep enough the way I wanted. Fine, find somebody else who does. I'm not that guy. If you're interested in what I have to offer, as a pretty good therapist who's learned to deal with a lot of different pain issues, I'm willing to have a conversation with you. But ultimately, you know what? You're going to decide what's best for you.
Yeah.
Does it need to hurt to be helpful?
Then we, as a former philosophy student, we get into a conversation about what hurt is. Mm-hmm. And sometimes in session, what I'll say is, listen, the work that I do when I talk to clients, I'll say it can be intense, but to me, intense is not pain. Mm-hmm. If it is too much pressure, just let me know and I'll back off. Yeah. I don't want to give you too much pressure. I want to, and I think this is a better word, I want to engage. Mm-hmm. And I would like your attention to be on what we're working on.
And I can't remember in our discussion that you just put on out the other day whether we talked about my 0 to 10 scale. Did we? Do you recall?
It may have come up briefly, but you can mention it again.
I want to mention it because I think it deserves a lot of attention. The 0 to 10 scale is, who doesn't know the 0 to 10 pain scale? And I can't tell you how many patients sit across the table from me when I say, well, 0 to 10, how much pain are you in right now? And they say, oh, I hate answering this question. It's like, good, I'm going to ask it anyway. Not only am I going to ask the 0 to 10, I'm going to nuance it a bit. I'm going to say 0 to 10, what's the worst pain you've had in the last couple of days? 0 to 10, where are you right now? 0 to 10, yep. Can you find yourself, can you find a position in space where you don't have pain, right? And if so, we may work from that in other ways, right? But while I'm treating, while I'm evaluating, if I can start communicating with your body, with your nervous system, and if I can touch you in a way where you start to sense relevance, right? I may be replicating something in terms of your pain, but just taking you to the edge of it. I'm going to ask you that question. Okay, right now, I'm replicating your symptoms. 0 to 10, how much pain are you feeling? Robert, you might say 4, right? That often is the end point. Oh, and I think from my training, et cetera, 4 out of 10, that's not too bad. This should be okay, but I don't know that for certain. I need to ask you the second question. What number would you stop me at? What would be your upper limit? What's your threshold? Because Robert, you might say, I'd stop you at a 10. Whereas the next person might say, I would stop you at a 5. And I personally don't like being held at just below my threshold. Like if that person sneezes or coughs, boom, we're off the chart, right? So I'm going to ask that second question. What number do you think you'd stop me at? What number would be too much, et cetera, right? And then I may back away from that because I want to work at a level of comfort that feels okay for you, right? So that used to be where I stopped, 0 to 10, how much pain are you feeling, 0 to 10, what number you would stop me at. But now I've added more questions, right? I'm all over the questions. Is there anything about what I'm doing that feels like it might be helpful, all right? It's a great question to ask patients, right? So here I am with my version of hopefully a neuroscience-based MFR, right? I'm holding somebody, I'm pressing, I'm stretching, I'm dragging their skin and everything that's attached, right? And they say, you know what? You're bringing my pain to my awareness. That's about a 2, and I'd stop you at an 8. Great, right? Does my pressure feel like it might be helpful? And I let them chew on that for a while. Because some patients have never been asked that. They're coming to me because of my expertise. They expect me to make the decisions. But I don't want to do that. I'll help you, but I'm not going to decide for you what's best. Tell me, is there anything about what I'm doing right now that your brain is interpreting as, ooh, I like that? Some say immediately, yeah, that feels great. And some will look at me and say, I don't really have a clue. Okay, that's fine. I understand that. Let's reverse the question then. If you don't know if it feels like it might be useful or helpful, is there anything about this static pressure that I'm doing or the dynamic engagement, dry or wet, right? Is there anything about what I'm doing that feels like it might be harmful? right? And give them ownership of that. Give them control of their process right now. And I found those questions really, really helpful. Instead of me making the treatment decision based on ego, right? Based on my vast years of training, my multiple levels of MFR training and experience, right? Where I'm supposed to dictate to you what's best for you. I don't know what you're feeling. I have no clue what you're feeling.
Yeah.
So tell me what you're feeling. Tell me how that feeling feels to you, right? Does it feel useful? Does it feel safe? And let's have this process of negotiation, all right?
When it comes to delivering pressure, I have a suspension system that allows me to do double-footed compressions and stand on people. But it's not supposed to be painful.
Okay.
It gets to a point where visually it gets to be, for therapists, what I notice in marketing, is it gets to be a bit of a gimmick. You can deliver deeper pressure and not hurt your hands. But it's not designed to be painful. It's not designed to be uncomfortable. It's very common that I have a session with someone and I spend maybe 20 minutes on the suspension system on something specific and the rest of it without.
Right, right.
But because of the suspension system, it's almost like you can dig a ditch with a hand trowel. And I've got a bobcat. I've got this, heavy equipment to do stuff.
Right.
But they think once they've seen the heavy equipment, it's all this. All the compressions are at 11. It's like all full body weight. It's like, no, it's just what the client needs.
Yeah. And just what the client hopefully is requesting, but not demanding, right? It's, again, I'm going to go back to this. If we let our patients dictate everything, right, it seems like we're meeting their needs and they're feeling satisfied. They're feeling they got their money's worth. They're not going to complain at the front desk when they leave. But we're going to negotiate a little bit, right? I could go heavier, but I don't feel it's necessary because right now, do you feel like I'm replicating that feeling you came in for, that maybe this could be useful? Now, they might say, yeah, but it's just not quite enough, right? I may redirect them back. Let's negotiate a little bit more. I feel like a car salesman here sometimes, right? You want me to stick my elbow in your eye socket and twist it, but I'm not going to do that, right? Your eye hurts, and you think deep tissue is the only way to get at it, but do you feel like somehow my pressure is replicating an experience that feels like it might be helpful? And even if it doesn't feel like it's what you hoped for, does it feel helpful, right? I'm going to negotiate that, and I'm going to stand my ground to a certain extent. And again, whether it's dry or wet, movement or still, the same principles can apply. If you work for somebody, right, you're working at a massage center, a spa, or heck, even at a hospital, right, if you're a PT, there's some sense that you're expected to meet the request of the client, right? But I still think there's space for negotiation in there, and there should be, right? And if not, maybe it's time to find a place where you can control your environment a bit more.
The control of the environment is why I work in private practice, and working on chronic pain is what fed me internally, financially, on all fronts. One of the things I've noticed about working with people in chronic pain is they don't particularly care what techniques or tools I use, so long as I can help them. And for me, that was the sweet spot and allowed my education, background, and training to stand out, where I had a wall of tools. I wasn't limited to, a certain set of tools. And I could say, oh, you're having this problem? Well, let's try this and see how this works. Oh, okay, that was okay, but let's try this. And then once we found what seemed to work best for that client, it was easy to apply that and feel like there was good clinical outcomes, and they were getting, pain relief, and they were, I think, more satisfied with the service, even if it didn't necessarily look like what you think of as a massage.
Right. Yeah. You're a licensed massage therapist, which allows you to do massage, but it allows you to do a whole lot of other things. I think massage therapists probably get get bookend in more to the title of their profession as being what they do for a living, maybe then a PT. I mean, PT, we certainly have that, I'm going to work in a gym, we're going to be exercising, we're going to talk about stability and strength and all that. And people walk into my office and it's like, where's all the stuff, right? There's no exercise equipment. It's me and my adjustable table here, right? But you guys get bookend in a lot easier, where if you're a massage therapist, you're expected to do massage, and many of you do, and it's wonderful work, right? But massage can take a lot of different faces, even traditional massage. It takes experience. I think it takes some courage to break away from some of those stereotypes that we put ourselves in, as well as we allow other people to put us in. And then if you get hired based on those stereotypes from someone else, the expectation is you're going to perform those duties that people think you're supposed to do. Well, if you get really good at something, let people know of that, right? I'm one of the go-to pain people in Rochester. People come to me because I'm good at helping people in pain and movement disorders. 15 years ago, or even longer, like when I started MFR, it was all about pushing out myofascial release as a modality, right? And we're kind of educated from the model that I was trained in, is you need to educate people on MFR and the secrets of fascia and all this stuff, and even to by the way, you're supposed to mention your mentor's name in the whole conversation process, right? But I hit a point where I realized, I read a book by Michael Port called Book Yourself Solid, where he talked about people don't care. People really don't care what you do. People care what you can do for them, right? So it became less about me pushing myofascial release or massage than it is, I'm really good at helping people in pain, and I may do it in ways that you're not quite expecting when you walk into my room, but let's have a conversation about it, all right?
It goes all across the map, from tools and techniques, how we interact with tissue, to marketing. Mm-hmm. Mm-hmm. And in the process of educating therapists, I myself just decided to break the massage box and rebrand what I was doing, because it didn't seem to matter who I worked on, especially in our industry. That was even more confusing. Mm-hmm. Clients didn't seem to have any issue. The clients came in and said, man, I don't even know how to tell people what you do. That was the issue clients had. They're like, Robert, your work is amazing, but I can't even tell my friends at a party what you do other than you help me with pain. Like I'm better, quote unquote, after I see you. Right. It's like they would tell me, compared to what I've had before, which people call massage, it seems to last longer. I'm out of pain longer. Or I would get someone where they had a chronic pain issue, so 10's hospital, 0's no pain. Let's say they've been at a 7 for a couple of years, something that really concerns me. 7 is at a point where you're shy of going to the hospital and you've been in pain that's like weighing on you psychically for years. I had an uncanny knack at helping people with that, reducing their pain to, say, a 3 or a 4 in session, showing them how to work on themselves. The pain would stay down, and over time it would drop even lower. Right. So they would get to a point with me where the sessions became maintenance. They liked to come in once a month or once every 2 or 3 months just for a session to kind of a check up and see how things are going, some maintenance. But for the most part, their problem had resolved. The challenge was for the clients is they would try to explain to people what I was doing, and they're like, no, it's not like massage. He works on a mat, and I keep my clothes on. And they're like, what kind of massage is you're clothed on a mat? What is this? Right. I had a marketing challenge. It wasn't a challenge to get the clients, because I was selling pain relief. Mm-hmm. And when the clients wanted pain relief, they didn't really care what tools I used, so long as I could help pain. But when it got to the point of trying to be an educator, the massage therapists were confused. Right. They looked at what I did, and everybody, it was like, at the time I called it time massage. Everybody I worked with said, you're doing trigger point therapy, you're doing myofascial release, you're doing active isolated stretching. They kept like trying to look at it from this vantage point and break it apart into all these little separate modalities. Mm-hmm. But I didn't really think in that box. To me, because the license as a massage therapist allows me to manipulate soft tissue, there are so many different ways to do that. Yeah, yeah. That are legal within my scope of practice, that I see
the actual license as being capable of allowing me a much broader interaction with clients than what I see represented in the bulk of the industry.
Right, right. And the bulk of manual therapy education is rabbit hole therapy, right? It's about getting you to come down the rabbit hole, in the Alice in Wonderland metaphor or analogy, right? Down the rabbit hole, so all you're seeing is the world from that modality, the world from that teacher and what they tell you. And they feed you a science. They feed you science that seems to make sense. And when you're in a closed community of other rabbits, right, the science seems to make sense, and you're constantly getting positive reinforcement from that peer group, right? But yet, if you stick your head out of that rabbit hole and look around, it's like nobody else believes what you believe. But the weird thing is we're all doing really, really similar things, right? You may say, well, Walt, it looks like you're doing trigger point therapy when you press there. It's like, you know what? I couldn't find a trigger point if you held a gun to my head because I never trained in trigger point therapy. I trained in something that said to me, ooh, there's a fascial restriction. But other people might say, no, there's a tunnel syndrome within a cutaneous nerve, but everybody's in their little rabbit hole, and they're down here, and almost okay, so I get in trouble when I say stuff like this, but the educators keep stuffing us back in there to take more work. No, don't listen to those other rabbits. They don't know what we know. They don't know the secrets of the fascia or the emotions or the trigger points or the neuromuscular or whatever, right? It's like this separate and conquer and all these rabbit holes with all of us down there. It's like, what? You stick your head up and it's like, you know what? We're all doing really, really similar things, but we have a whole different language to explain it, right? All the work that we do, and I don't care whether it's MFR, trigger point, Thai massage, effleurage, it's all really, really useful. I just think you can take every modality and maybe package it a little bit differently and have a better communication, more honest communication with the client, a negotiation where we started this conversation, right? A negotiation of what's going to happen versus either one of us dictating what's going to happen with certainty in this session.
Yeah.
And I know that, on Facebook Live here, I can see who's coming and going in the conversation. And I know that I've seen some names pop up here of some folks who have been less than pleased with the fact that I'm holding on to myofascial release as a title for what I do. I've been round and around for the last couple of years with a lot of different folks on this topic because people think that, first of all, there is nothing to release. Release is nothing more than a bad metaphor. That fascia doesn't react the way most modality teachers teach it does, right? Why do I keep the words MFR? I keep them because it represents the style of engagement that people historically view as myofascial release. And I think there's value in that, right? If you've had myofascial release from somebody else, you might come into my session and say, you know what, this doesn't resemble at all what I did in the past. Why aren't you digging at my emotions like the other therapist did, right? I still use MFR as the title because it represents what I do with my hands. My brain is thinking totally different things.
Yeah, the theory behind it is completely different. And that's where I started to encounter issues. Part of the reason I decided to rebrand was because massage therapists would come see me. They would get a session. My sessions are 3 hours long. The client who was a massage therapist had Thai massage before, and they would freak out. And they would go, I don't understand what you just did.
Right.
I've had Thai massage before. That was nothing like what I've had before. And I'd say, oh, okay, hold on. Do you feel good? Was the session good? Do you feel better? And they're like, no, it was amazing. I've never felt this good after a session, but what you did wasn't Thai massage. Now, I wrote 700 pages of sequence manuals on Thai massage. In February, we'll shoot the last DVD set. It'll be 9 DVDs. I dedicated the vast portion of my career to mastering, if you will, Thai massage. Only to be told what I had just done wasn't Thai massage. And I'd say, what's different about it compared to what you've had previously? And they said, you just worked on me. The other Thai massages I've had, they just did a sequence. And I was like, oh, yeah, no, I don't. The sequences are just a jumping off point that give me enough tools, if you will,
Right.
to figure out in communication with Walt, well, okay, Walt's having issues with his legs, so let's work on Walt's legs and communicate with Walt. And when I do that, the session goes off-road because it's not a sequence anymore. Essentially, what it felt like was both intellectually, because of contact with educators like you, Walt, who were helping me understand a little bit more about pain science and the theoretical component, what was going on mentally. Not the tissue application, but what was going on mentally. And then also from a standpoint of explaining to clients from a marketing sense what they were going to be receiving, it made sense to rebrand and create a new box that had different parameters, because it felt like I was selling a different service than what the culture expected. And it was actually causing some issues because, so I'll give you a quick example. Massage therapists, in my experience, are very happy to sell gift certificates. They love Christmas time because they sell gift certificates. I stopped doing that years ago. If I have someone who requests, I'd like to buy a session for someone, I don't deny that. But I don't make gift certificates, and I don't go out of my way to do that, because a client could buy a gift certificate for a friend and send them in. That friend would do no research on what I do, and they would come in and go, "Where's the table?" And I'd go, "No, this doesn't." It was like it was selling a different service that didn't really fit what they were looking for, even though the friend really liked it.
Right. I never had that problem because, like, who the hell wants a gift certificate to see a physical therapist, right? I mean, very few people would do that, right?
Yeah.
I want to jump off into a slightly different direction here for a second. When we're talking, I'm going to kind of go back to the concept of negotiation, of giving the empowerment to the patient, or at least the conversation with the patient. PTs, I guess less so the massage therapy community in the United States right now, but I do think it's going to evolve into that. But PTs, OTs, speech pathologists, other people that I work with in my various classes, we're under the responsibility to we're supposed to be always working from evidence-based practice, right? Evidence-based practice is often viewed by people as everything that we do has to be totally explained by a piece of research or a body of research. If you take a look at the core of evidence-based practice, it's three equal legs of a stool, if you will, right? One of those legs is the published research. Another third is the therapist experience, right? Our experience using that. But a whole third of that evidence-based model is given to patient expectations and values, right? And to me, allowing my patient input into pressures, into style, without controlling it, right, is really honoring that concept of the evidence-based practice, because I can pull up evidence that supports the work I do, whether it's some of the flimsy evidence for MFR, some of the better evidence for manual therapy, but from a pain science perspective, from a behavioral science perspective, engaging you in the process, it gives you investment, it gives you a sense of being valued, and most importantly, it gives you a sense of being heard. And I just think that sometimes the patients are heard too much because they dictate things. Sometimes they're not heard at all because we're telling them what they need. We're telling them what's wrong with them, and we're telling them how treatment should look. And this should be a respectful relationship versus a one-sided dictatorial type relationship.
Yeah.
So, I'm just reading some of these comments on here. Sequence is usually for relaxation, not for working out an issue. That's where I'm going to allow things to separate out a bit. I don't get people coming to me for a relaxation session. So I'm going to speak less to that in conversations like this in my writing, but I'm also not going to downplay it or minimize it or put it on a hierarchical lower plane than quote-unquote serious work or medical massage. Relaxation massage, relaxation treatment, you can explain it and the outcomes and the expectations from it from a lot of different perspectives. If you look at it from a sense of the autonomics, right? If I can put you in a place where parasympathetic dominance predominates, you may be better suited to go out and start moving in less pain. Full body relaxation response often, or full body relaxation massage often gets, I'm just going to say minimized, right? It's a lesser than some of what is perceived as more serious work, more site-specific work. But if I can affect autonomics in a way that a relaxation massage or relaxation treatment can, that could be as equal to, or in potentially even of greater value than the quote-unquote serious work that we all think we're doing. So thanks, Steve, for that comment.
I don't really make a separation. I think that there's so much complexity and nuance to the conversation that we're having. It could go in so many different directions. What I decided to do was, what context allows me the greatest opportunity to help people in chronic pain, help people with the overarching sort of stress that we have in our lives, and allows me as a therapist access to the greatest number of tools. Mm-hmm. And that was how I crafted what I did and then trademarked Reboot. Because I felt like I worked in a chiropractor's office. The last job I had working for someone else, this has been several years ago. We billed insurance, and we were really only allowed 30 minutes or an hour. And the way it started to feel like was I was putting a Band-Aid on a tumor. Because the client would come in with something that it felt like they had maybe developed over the course of 7 years, sitting at a computer, maintaining a certain posture that wasn't the best, and now I have 30 minutes, and we're just shuffling these people through like it's a drive-through. Mm-hmm. Mm-hmm. We have to bill insurance again. And I'd say, if they would even give me just 90 minutes, it would probably give them better clinical outcomes, and it would last longer. Mm-hmm. Like their relief, their sense of well-being. And then I would start in my private practice at that same time. I had a home studio for the first time. I went crazy, and I made the sessions 2 hours long. And eventually that evolved into 3. And even then I got blowback from massage therapists who said, people won't pay for a 3-hour session. And I said, well, then those people aren't my clients. Mm-hmm. Because I think there's enough that will get a 3-hour session. Mm-hmm. And I think there's enough that will value the fact that I can use all of these tools. And there are enough that will value that communication and interaction that I think I can make a living building what I'm doing and not hurt myself in the process, not feel rushed.
And I don't feel like you're advocating or pressuring everybody else to switch to your version of time massage, which is a 3-hour session, just like I'm not trying to pressure anybody to do what I do. And I see most of my people in either 25 or 50-minute sessions. I've been doing it for so many years now. You get done what you need to get done, and I find it very efficient. And I do bill some insurances because as a PT I can do that and make a livable wage, right? But I think at its core, the principles that Robert and I are talking about today are applicable to just about anybody out there in that broader manual therapy community, not just the niche of massage or PT or whoever else we might be, but as manual therapists, I do think it's about beginning to make choices. Therapists tend to stay as generalists because they don't ever want to exclude anybody because they feel like, well, my business, my income will drop. I think sometimes the opposite is true. Instead of being a generalist, be a specialist. Now, what does a specialist mean? It can mean a lot of different things to different people. My specialty is pain relief. The name of my practice here in Rochester is the Pain Relief Center. That means it's not the only thing that I work with, but it gets people in the door. I branded myself as a pain relief person, and I think as a result of that, my business has actually grown versus the PT clinic on the corner who has a budget to do a lot more advertising than me because they're owned by the local hospital or whatever. It's sometimes you got to take that risk to narrow your niche in terms of what you like to do, and it could be something as simple as my hands just can't take this anymore, right? What can I do because I love my work and I want to continue to do it? What can I do so I can continue doing that, right? Start thinking about the marketing approach, the branding approach, and not branding per se, but branding yourself as becoming a specialist for something.
Yeah.
So. What else would we talk about?
Well, from a biomechanics standpoint, people can find videos on my YouTube channel and see that I'm working on a mat. My work sometimes looks more like Brazilian Jiu-Jitsu than it does massage.
Okay.
When I talk to the average massage therapist, they're using their hands and forearms and elbows on a table. Mm-hmm. And I come in and there's no table. I'm using my legs and feet and knees. And I'm using typically like more points of contact. There's more body contact with what I do. Now, I'm not saying that in and of itself is more effective. It just depends on the client, communication, a whole host of other factors. But what it feels like is I'm in an industry full of boxers. They have a jab and an uppercut, and a jab and an uppercut. They're hurting themselves because of the compressive force that's going on through these little small structures. They're using these, tiny muscles to try to like muscle through people's backs. And I go, why don't you just stand on them?
Well,
it's kind of what it amounts to, because I'm using legs and feet, and it's like basically it's like going into a fight between somebody who does Brazilian Jiu-Jitsu and somebody who's a boxer. And then they wouldn't allow me to use my legs and feet because they're like, no, you're a massage therapist. Mm-hmm. You can't do this thing on a mat. Right. And I'm like, okay, I'm going to work in private practice and do it. But the therapists seem consistently confused because I feel like I'm practicing a very distinctly different art.
Right.
It's like we all know that boxing and Brazilian Jiu-Jitsu are not the same thing. And I'm using all of my body, not just my hands and arms. That's a big critique I have of the massage community.
Right. Again, I'm going to go back to that conversation that's happening on Facebook right now where a therapist asked about what sort of tools you can use to save your hands. And I get that totally. I get all the responses that we're giving from tools, right? Because I used tools earlier in my manual therapy career too. Or using your body weight, like you're talking about, using barefoot massage, all the different type of things that are out there. But there's an interesting, and I'm not saying you're doing this, Robert, but there's an interesting trend with almost all the responses there is you're giving substitutes or alternatives for feeding that belief that you have to be working at those super deep levels to be effective, all right? And if a tool helps you with that and that's what you feel is helpful and the patient feels helpful, great. But how about questioning some of those things you were taught, right? We're going to start, first, let's go back to the person who taught it to us, right? It's okay to question our elders, so to speak, right? And I get trashed a lot for questioning my elder in this field, but oh well, that's life, right? But it's okay to say, do we have to do it that way? Do we have to use a 7 or a 9 out of 10 pressure in order to affect that painful spot? I just don't see that really as necessary. And it sometimes becomes easier to question the person who taught it to you or the school that taught you or whatever that is than it is to question the person who's paying you money, right? If that's what they really feel they want, you have a choice. You either give it to them or you give them a car to somebody who will. It's totally your choice. And I don't have a judgment either way because I know that, again, let's go back to that evidence-based model. If I come to see Robert and my belief, my expectation and my value is that you need to get a hunting knife out and carve that freaking trigger point out of me because it's the only way I'm going to accomplish pain relief. There's a reasonable prospect that might actually come to fruition because my brain plays such a huge part in all this that my expectation is. Now, yeah, Robert, you may try and educate me that, that's not quite how it works, but you have to ease into that, baby steps, right? The expectation is that you may need to get that hunting knife out on me, but I put my hunting knife away. I'm not going to use it anymore. I'm going to use the tools and the knowledge that I have to help you. But if I can't help you, I'm very eager and willing to pass you on to somebody else who might use their hunting knife on you.
Yeah.
Yeah.
The difference just between saying I'm ceasing to call what I do a massage, I call it a reboot, and then I call it manual therapy. And I like manual therapy as a term far better than massage at this stage in my career because I felt like massage was pigeonholing me into working on a table using effleurage with people who didn't have clothes on. And that wasn't what I was doing, so I had to figure out, much like when you had the conversation about MFR, you haven't rebranded. And we can discuss the merits or disadvantages of that.
Right.
But in the end, I just didn't want to be pigeonholed. I didn't want in other words, I don't even want my clients to come in and dictate, you have to do this on me.
Right.
I'm like, no, we're going to work together and figure out what's going to work best between us.
Right. Comments that come up here. I'm trying to use my bifocals to read the comments while I'm looking down at you with my regular ones. But question, a comment from Steve regarding hands and pre-existing condition, not understanding why somebody's hands can hurt if you're stacking your joints, all that stuff is. I understand that massage, like a lot of other professions, people are coming into second, third careers. You're bringing in your whole life up into this point. It's easy for me to say, well, you're just not stacking your joints, or you're not using your body mechanics properly. But I think that's way oversimplifying the complexities of our human condition, of our past and present, right? Somebody may simply have pain in their hand that they became a massage therapist and it's only getting worse. Well, okay, try your feet, try your tools, or try changing your narrative, try changing how you view it necessary. I think it takes courage to break from what you were taught. I think it takes courage to break from the people who taught it to you, right? I think it takes courage to question those people and say, you know what? There's a lot of rabbit holes out here. Maybe I'll find a rabbit hole that feels more comfortable for me. Or better yet, don't bother with a rabbit hole, right? Let's look at the body from a pain science perspective, from that maybe it's something as simple as the skin, or the neurology contained within the skin, or the nerves in the superficial layers. It still could be the trigger point, or the fascial restriction, or the sublux joint, or all that stuff that people's rabbit holes say, right? But I do think there's simpler explanations for the work that we do. It's just really, really hard to sell some of those simple explanations because the rabbit hole modality empires are really strong in this profession.
Yeah. It's trying to explain to students elements of branding and then elements of the theoretical implications of what I'm doing, because I'm not trying to restrict them. I'm actively encouraging them to question what I'm doing and question me.
Yeah.
And there is such unfortunately, and it's not just in our industry, I think it's just across the board. I don't feel like our educational system sets people up to question things.
No.
It's a top-down model where we deliver the truth. And unfortunately, there are times in class where I feel like the students on some level, it's almost like they want a guru. Yeah. They want a wise, experienced teacher to dispense the truth.
Right.
And all I keep doing is giving them more questions, and some of the students actually get annoyed. They start to become very uncomfortable because they're like, well, if he's doing all this and saying he gets, good clinical outcomes, but he's doing things in a radically different way than what I was taught, and they're going, like, he's questioning the school.
Right.
He's questioning not the modality empire. He's questioning the formal education, and I'm like, yes.
Yeah. And for those of you that that aren't quite know what I'm talking about with the modality or Robert target, go to Paul Ingraham's website. I think it's painscience.com. He's got a really nice blog article on modality empires, and whether we like it or not, a lot of those what Paul says there are really true about how we were taught. One of my most popular seminars is one for neck, voice, and swallowing issues. It's a seminar that 90% of the participants, not all of them, but the vast majority are speech pathologists. I'm a PT, right? What do I know about speech pathology? I'm knowing more about it, but one of the first things I say is, from a real sense of honesty, is, I don't know what you know. I don't know your patient population. I don't know your education. You got a lot, different education than me, and the rabbit holes that you can go down, I don't even know what you're talking about, right? So the point of that seminar is for not to be the expert in how to apply manual therapy or myofascial release in the speech pathology community. It's to build a bridge of communication through touch about patient-directed type models where, you're going to use your speech pathology background and training and expertise. You're simply maybe going to apply a nuanced type of touch or stretch or input to see if that can help that patient of yours. And, from a being the expert point of view, the people are paying me money to take that workshop, but I don't come off as a speech pathology or expert in any other way except I'm really good at manual therapy, and hopefully I can help build a bridge to allow you to be really good at it too. Humility, unfortunately, the higher up you go in a top-down society or top-down business like ours, humility is rare at upper levels. Not trying to pat myself on the back, but if I can reach, I will go ahead and do that. Right? I think humility is important. I think the ability to not view yourself as the master, as the expert, or or the guru, right? View yourself as a participant in a human interaction every time somebody walks into that room with you, and try to find out what you can do to help them based on that sense of communication and negotiation.
Yeah. Somebody was visiting my wife yesterday, and he had asked me if I would, he was having a little bit of discomfort in his neck and back. And he was sitting in a chair, and I worked on it for just a minute based on, 15 years of clinical experience, and said, hey, I think you're just having a problem with these vertebrae here. I think the muscles are just a little tight. Worked on him for a few minutes, had him come in, lay on a foam roll, showed him this other tool so he could apply a little pressure himself and learn how to work on himself, which is really replicating pieces of my sessions where it's not just me delivering the session. It's me educating the client about ways in which they can work on themselves and replicate some of the same benefits. Mm-hmm. And in that, 20 minutes, invaluable. Because if I can educate the client, if I can help them, even if I have a question, I'm like, I don't know. If I can educate the client about my I don't knows,
right.
It brings us to this common ground where they're able to work on themselves with a little bit of education, and then ask better questions about, I don't know, are you having tension there because you sit at a computer? Right. Is it just because, in other words, not sitting at a computer is bad, but are you holding a certain posture unthinkingly, without awareness because you're focused on whatever work you're doing? Right. Those sorts of things really made my practice stand out. And in classes, when I'm working with students, I can tell they're often taken aback and uncomfortable because they wanted someone to dispense the truth.
Oh gosh,
and
yeah.
I come in and start asking more questions, and they get more uncomfortable.
I think that's one. Let's talk about that one more thing here. That sense of that they come into us as the expert, and they expect us to give them a diagnosis, or even if legally you're not allowed to do that, give them an assessment of what's wrong with them. Right. Well, my last therapist said I had the worst trigger points they ever felt. What do you think, Walt? Well, the first thing I want to say is, what an ass that last therapist is for saying that, for over pathologizing your sense that you're the worst case they ever saw, right? But yet they expect stuff like that out of it, and we're more than willing to give it to them, right? But we usually answer the question from our rabbit hole, right? Oh, you've got terrible fascial restrictions, or you got terrible scar tissue, or subluxations, or trigger points, or fill in the blank on 1,000 other things you can tell people, right? People expect that from us, and I don't give it, right? Or if they grab me by the shirt and say something, tell me what's wrong with me, right? And I get the sort of the, not the quite so aggressive equivalent of that. I get that they're looking for an answer. And I may say, well, your previous therapist or your doctor said this, this, and this. And it certainly could be that. I'm not going to discount or minimize anything that a previous person has said, because that's just it. I don't feel that's right. I may add a few other ideas, but I'm also going to give them the sense that depending on who you see, the answer is going to be different. And that doesn't mean all those things are right nor wrong. It may simply mean that none of us really have the answer the way that we think we do, right? So I may feed you a little bit what you expect, but then I'm going to redirect the conversation back into whatever it is, whether it's a trigger point or scar tissue or fascial restriction or emotional holding patterns or whatever baggage somebody's planted in your brain, right? whatever that is, you're feeling that right now, right? You're feeling that whatever I'm doing with my hand feels like I'm connected with that, and whatever it is, does it feel helpful, right? And if it is, how about if we just hang out here for a bit? Let's hang out here with this pressure that I'm applying to your body. And whether it's the trigger point melting, the fascia restriction releasing, or whether it's your central nervous system and brain processing and allowing a change in outcomes, which I think is probably the more plausible and probable thing that's happening when we work static, dynamic, wet, dry. I think, and a lot of people agree, that it's more central nervous system and brain driven versus tissue specific driven, right? I got to give him an answer. I can't get away with acting dumb all the time. I try as much as possible, right? Because I don't want to feed you another pathology to add to this list of things that's wrong with you, right? But I'm going to redirect the conversation back to, what are you feeling at this moment? Does it feel like it might be helpful? Sorry, just reading some of these here. Yeah.
We arrive at such similar conclusions from very different background and training.
Mm-hmm.
When I studied with you, I never forget taking class, and you came over at one point, and we were doing something like there was a little bit of like a twist on somebody's hip or leg, and it was this kind of static hold and mobilization. And you came over and you went, Robert, is this similar to what you do in session? Mm-hmm. And I was like, Walt, yeah. This is what I've done all day for like 10 years.
Right. But yet the rabbit holes, right, the modalities have trained us to think, oh no, Thai massage is very different from MFR. And, each one tends to elevate their modality to a higher level and explain why it's superior and others are less than superior. But the overlap between what we do for a living, all of us, not just Robert and I, right, of what we do for a living is massive. Can we strip it down to something simpler, something a tad more sterile? You can continue to use the recipes that you were taught in your modality or the recipes that you found effective. And I don't use the word recipe in a negative way. We all learn recipes. Even the MFR that I learned was all about every session is unique, but yet the recipe was still there. You still tried to get that person in touch with their emotion, the emotional holding patterns of that fascia restriction. That's a recipe in and of itself, despite what you want to know, right? We learn these recipes, but yet there is something similar about all the work we do. Make it more patient-directed, negotiate more. Have a better conversation and an equal plane between therapist and patient. Don't let one become dominant, all right? Ooh, silence.
Oh, no, it's just
no, it's good. Yeah.
Go.
Yeah.
Internally, it's, talking about the work itself and then talking about marketing.
Right.
And when it came to the work itself, I felt like there were so many modality empires and there were so many educators pushing their holy grail secrets or whatever they do, that I started giving therapists business advice because there was way less competition over here. And part of the way I was winning was by giving therapists business advice. And then when the therapists trusted me, when they started applying business advice and it was working, they went, Robert must know what he's talking about.
Mm-hmm. Yeah.
Because I was packaging a service in a very different way than I saw in the industry. And there's a twofold component to that. One, it doesn't look like what other people are doing. And on the beneficial side, it doesn't look like what other people are doing. It stands out, which is from a business side was good.
Right. All right. I'm going to have to beg out of the conversation now, but we got a lot of food for thought for future ones, right?
Oh, always.
Yeah.
So if you're watching this, by the way, Walt, can you tell them where they can find more information about you online?
Oh, absolutely. WaltFritz.com, www.foundationsandmfr.com. Check me out on Facebook. Send me a friend request. I'm really, really approachable, whether it's Facebook or email, for questions, that sort of thing. I've got a blog. I've got MedBridge video or online trainings. Lots of good stuff. Just drop a Google for Walt Fritz and the page will populate and you'll find me.
Cool.
Great.
Thank you so much
And,
for talking
and Robert,
with me
thanks
today.
again for having me. This is the first Facebook Live interview I've done, and I actually enjoyed. I just I need to adjust my glasses so I can read the comments without tipping my head so much. But yeah, I know we talked about doing these again, and if anybody has anything they'd like to see Robert and I talk about, that would be fun to kind of address some of those comments too. So thanks again.
Yeah. Cool.
Okay.
Thank you so much. You have a great day, Walt.
Thanks. You too. Bye all.
Bye.